What I see happening are people who are seeing national security as a self-absorbed interest. It's going to cost me more. But what is it costing the nation in terms of overall health care costs and the competitiveness of our economy?
Let me just dialogue with you a little bit, because everybody's got disease here today. You want to talk a lot, and I understand.
High five.
No, don't you apologize, because I'm glad you're here. But the point I wanted to make is that we went and you mentioned the Farm Bill. We spent a lot of time doing this kind of business, talking it over and trying to figure out what we could do. And adjustments were made. So I'm hoping with the information I'm hearing today that I can stay at the table. I've worked very hard to get to the table and share some of these thoughts. So I just want you to know that.
Okay. Well, what I'm most afraid of is that we're going to ignore the overall impact on the economy if we do not become more competitive. The reason we're not competitive is because employers have to pay health care coverage, right? And everyone thinks that health care coverage is free. It is not. You pay for it in lost jobs, lost wages that go to foreign countries who can build it cheaper and ship it over here, and then we buy foreign-made goods because we can't produce them here because our economy is so burdened with the health care costs. I pay $16,000 a year in health insurance premium. I don't get it from anybody. It's not free. It comes out of my pocket. And $4,000 in deductible. Now imagine, if you will, what I could spend that money on if I had an affordable health care plan through the federal government. Thank you.
It seems to me, just trying to use this,
you wouldn't have the coverage.
This farmer's approach to things that you do, I think, as well. I think it's having a tremendous impact on our economy. It really is. If you want the economy to suffer from this, it's really hitting because the price just keeps going like this, and there's no indication it's not going to keep doing that. And if you're putting out that kind of money now, what are you going to be faced with in another 2 or 3 years? And I don't know. You're going to have another farm in there somehow or other. But anyway, it's just it seems to me like we have to, which costs us more in this country per capita than anywhere in the world. And as we now have finally decided to get into the efficiencies of it and compare what we can do compared to some of the other places, we don't measure up so good. So we really ought to have this study going on and this effort. So I'm glad we finally aren't kicking the can down the road, because this thing is eating us up. And a lot of people without care, and what's happening to you and probably many others in the room, there's probably 3 categories. There's people that are pretty well off and they're going to have health care regardless. And then there's people like maybe yourself, and I don't know that much about you, but I'm trying to kind of figure it out. You got health care and you probably wonder, can I keep it? Can I afford it? You raise the deductibility, at what point will I have to say, I can't do this? Then there's the other category, they just don't have it. So I think it's appropriate that we go through the exercise we're going through and see what we can do. And I don't know what's going to come out at the end. I really don't. I know that it's a serious matter because of your presence here, and I do it without your presence here. So let's work at it very hard and see what we can come up with, and that's what the process is all about. And so thank you for your comments very much.
Mr. Boswell, thank you for taking my question. My name is Rich Zeiss, and I live up in Urbana, which is in the most hintermost regions of your district in northeast Benton County. I'm here representing myself today. I don't represent anybody else. No one has asked me to ask you these questions. The health insurance policy that works best for me is a high deductible catastrophic plan. I'm very satisfied with that. But under this proposal, it will no longer be considered an acceptable plan. Why do the people in Washington think they know more about my insurance health care needs than I do?
Well, first off, I don't think that at all. I don't think that, and I'll just speak for me. You're speaking for yourself. You said that very clearly. Let me speak for Leonard Boswell. I don't feel that way at all. That's why I spend so much time in the district, having discussions with individuals and groups and so on, and you know that's my reputation, and I'll keep doing that. So appreciate that deal. I don't know that that issue is in this bill, as you say, or not. And if you'll take one of these slips and give us your name and how we can contact you, we'll be glad to look into it and have more dialogue with you and see what's really there.
Thank you.
Because I think you're making a good point. Thank you for coming. I appreciate it. There are cards coming your way, so you share it back to us and we'll have a discussion. Alexis, I lost you again.
Right here, sir.
Oh, over here.
Hi, everybody. My name is Bill Wallace, and I'm a veteran, and I go to the VA hospital in Iowa City, and I get really good treatment. Oh, #1. I'm sorry to tell you that. I know you probably don't like to hear that. But we can do it. I know you don't like government. I can understand it. But you do listen to a lot of people who are pretty brainless about this. Try to go the middle path on it. Try to understand a little bit. It's not going to be easy, but we need to have understanding. We need to try to compromise. Don't be fanatics and don't be wishy-washy. And please, if you see a poor Mexican that's got his hand cut off or something, take him to the hospital, would you? I'm sorry.
Why? They won't.
Because he's a human being. Remember the Good Samaritan. The Good Samaritan. The Christian way. Thank you, Congressman. Excuse me for being so outspoken.
Did you have a question?
What am I doing here?
Well, there's probably 2 or 3 others wondering as well. But anyway, thank you for your comments, and I, by the way, just as you talked about the Veterans Administration, and well, we are in conversation, Alexis and I, we've had a couple meetings, we're trying to get another one, put it together right away. We're working on that, and the thing's going to happen soon, to deal with the care for veterans. And I think that we're well on our way to get this waiting list done away with. And we've done a number of things since I've been there to help veterans, and I'm very much engaged in it. And thank you for your service to our country. Thank you very much.
Hi, I appreciate you coming out today. I have a lot of concerns, but I only want to ask one short question. There have been, people have gone back and forth on whether or not the bills that have been proposed include taxpayer coverage for abortion, and some people say it does, and some people say it doesn't. But I want to ask you if the bill that is voted on includes taxpayer coverage for abortion. Will you vote for that bill?
Well, it doesn't, and I don't think I'm going to have to. It doesn't.
If it does, will you?
Well, if the sun don't shine, it'll be dark. I know. You all know that.
Yes or no?
Can't you make that decision now? You know how you stand on abortion and how your constituents stand on abortion.
And you know where I stand too. That I don't take away your choice.
Will you support taxpayer money for abortion?
Everybody knows that. So if we wasn't taking time away from this subject, I'd like to explain that to you, because I'm a person of faith, and I would hope as much as the rest of you. And I respect life as much as the rest of you. And it's like some of you, I've put my life on the line for the rest of us. So I respect it very much. And we can talk about that. So I'll be glad to do it.
Hi, Congressman. My name's Kathy Warner. I'm from West Des Moines. And just one point, I didn't read the bill like everybody else, but is pre-existing conditions going to be considered?
This is one of the things that I think you'd be happy about. Pre-existing conditions, as the draft is written, will not prevent you from getting insurance. And